For thousands of years, people relied on plants not because they were alternative, but because they were the only medicine that existed. Before antibiotics, before synthetic anti-inflammatories, before laboratory-designed drugs, there were plants that stopped infection, plants that reduced pain, plants that calmed inflammation, plants that supported healing in ways people could observe directly. And then something changed. As modern pharmaceuticals emerged in the late 19th and 20th centuries, many of these plants were pushed aside, not necessarily because they didn't work, but because they were harder to patent, harder to standardize, and harder to commercialize. Some were studied, some were modified into drugs, some were simply forgotten. In this video, we're exploring 20 healing plants modern medicine tried to replace, plants that were once considered frontline remedies long before hospitals, prescriptions, and over-the-counter pills became the norm. Stick around, because number 18 was used to fight infections before antibiotics existed, and number 20 became the blueprint for an entire category of modern drugs. Let's begin. Number 1. Willow bark. The original pain reliever. Long before aspirin existed, willow bark was used to reduce pain and fever. Ancient civilizations across Europe and Asia brewed it into teas for headaches, joint discomfort, and inflammation. The reason? Willow bark contains salicin, a compound that the body converts into salicylic acid. In fact, modern aspirin was developed by chemically modifying compounds, originally derived from willow bark. The plant wasn't ineffective, it was refined. Pharmaceutical companies isolated, standardized, and mass-produced the active component. But for centuries before that, people relied on the bark itself. Willow didn't disappear because it failed. It was replaced because it inspired something patentable. Number 2. Foxglove. The heart regulator. Foxglove is a striking plant, tall, elegant, and toxic if misused. But historically, it was used carefully to support heart function. In the 18th century, physicians documented its ability to strengthen irregular heart rhythms. Eventually, scientists isolated compounds from foxglove that led to the development of digitalis, a modern heart medication. The plant itself was too unpredictable in raw form, so the active compound was extracted, purified, and controlled. Foxglove wasn't abandoned because it lacked effect. It was transformed into pharmaceutical form. Its existence proves something important. Many modern drugs began as plants. Number 3. Turmeric, the anti-inflammatory predecessor. For thousands of years, turmeric was used across India and the Middle East as an inflammation regulator. Long before non-steroidal anti-inflammatory drugs existed, turmeric was incorporated into daily diets to reduce joint discomfort and systemic inflammation. Its active compound, curcumin, has now been studied extensively for its role in inflammatory signaling pathways. But turmeric itself cannot be patented in its natural form. So while modern medicine continues studying curcumin derivatives, the whole root remains a traditional staple. It wasn't removed because it failed. It was overshadowed by faster-acting synthetics. Number 4. Garlic, the pre-antibiotic defender. Before antibiotics existed, garlic was widely used to fight infection. During both world wars, crushed garlic was applied to wounds to help reduce bacterial spread when medical supplies were limited. Modern research confirms garlic contains allicin, a compound studied for antimicrobial properties. But once antibiotics were discovered and mass-produced, garlic's medicinal status diminished in mainstream settings. It didn't stop working. It simply stopped being first-line treatment. Garlic represents something significant, an antimicrobial plant used long before laboratories created synthetic alternatives. Number 5. Echinacea, the immune stimulator. Echinacea was used by Native American tribes for generations to support immune response and wound healing. When early American physicians adopted it, echinacea became one of the most prescribed botanical remedies in the United States in the early 1900s. But after the rise of antibiotics and pharmaceutical standardization, its popularity in conventional medicine declined. Modern studies continue examining echinacea's immune-modulating properties. It wasn't erased, it was deprioritized. Echinacea stands as a reminder that plant medicine once held primary status, not complementary status. Number 6. Comfrey. The tissue accelerator. Before synthetic wound creams and anti-inflammatory gels existed, comfrey was known as knit bone. Medieval herbalists used it to support recovery from sprains, fractures, and deep bruising. Its botanical name, symphytum, comes from a Greek word meaning to grow together. Modern analysis shows comfrey contains allantoin, a compound associated with cell proliferation and tissue regeneration. Today, allantoin is used in pharmaceutical and cosmetic formulations for skin repair. But raw comfrey itself became controversial due to internal safety concerns related to certain alkaloids. Instead of refining safe external use, mainstream medicine largely abandoned the plant and isolated safer synthetic alternatives. Comfrey didn't vanish because it lacked effect. It was replaced because synthetics were easier to regulate and standardize. Number 7. St. John's wort, the mood stabilizer. Long before modern antidepressants were developed, St. John's wort was used in European herbal systems for mood support and nervous system balance. By the 1800s, it was a common botanical prescription. Modern studies have examined compounds like hypericin and hyperforin for their influence on neurotransmitter activity. In some regions, standardized extracts are still prescribed for mild to moderate mood support. But once pharmaceutical antidepressants were introduced, plant-based mood regulators were largely pushed aside in conventional practice. The irony: modern drugs target similar neurological pathways. St. John's wort wasn't primitive, it was foundational. Number 8. Golden seal. The natural antimicrobial golden seal root was once considered one of the most important antimicrobial herbs in North America. Used traditionally for infections of the skin, throat, and digestive tract, it gained widespread popularity in the 19th century. The plant contains berberine, a compound now studied extensively for antimicrobial and metabolic supporting properties. Today, berberine is isolated, extracted, and sold in purified supplement form. But the whole root, once a staple of botanical medicine, faded from primary medical use after the rise of antibiotics. Golden seal didn't disappear because it stopped working. It was overshadowed by faster, more aggressive synthetic drugs. Number 9. Meadowsweet, the aspirin ancestor. Much like willow bark, meadowsweet contains salicylate compounds associated with pain relief and fever reduction. In fact, the name aspirin is partly derived from Spirea, the botanical genus of meadowsweet. Before aspirin tablets were mass-produced, people relied on meadowsweet infusions to manage discomfort. When pharmaceutical companies refined and acetylated salicylic acid to create a stable, patentable drug, the plant itself lost prominence in conventional medicine. The relief remained. The source changed. Meadowsweet represents a recurring pattern. Plants inspire drugs, then drugs replace plants. Number 10. Artemisia, the malaria fighter. Artemisia annua, also known as sweet wormwood, has been used in traditional Chinese medicine for centuries to reduce fevers. In the 20th century, scientists isolated artemisinin from the plant, a compound that became one of the most important treatments for malaria worldwide. The discovery earned a Nobel Prize, but long before isolation and purification, the plant itself was used as a fever remedy. Artemisia wasn't ignored because it lacked potency. It became the blueprint for modern anti-malarial pharmaceuticals. This pattern is undeniable. Many so-called modern breakthroughs began as leaves, roots, bark, and resins. They weren't replaced because they were myths. They were replaced because they were modified. Number 11. Oregano, the wild antimicrobial. Today, oregano is seen as a kitchen herb, but before pharmaceutical antibiotics existed, wild oregano oil was used across Mediterranean regions to combat infection. Modern laboratory studies have examined compounds like carvacrol and thymol for antimicrobial activity against bacteria and fungi. In fact, oregano oil is still studied in integrative settings for microbial balance. Yet once synthetic antibiotics became dominant in the mid-20th century, plant-based antimicrobials were largely dismissed as secondary. Oregano did not disappear because it lacked effect. It disappeared because pharmaceuticals worked faster and could be mass-produced. But the plant remains, still potent, still studied, still used quietly. Number 12. Feverfew, the migraine predecessor. Feverfew has been used since ancient Greek times for headaches and inflammatory pain. The plant contains parthenolide, a compound studied for its potential role in migraine prevention and inflammatory modulation. Before modern migraine medications were developed, feverfew tea and tinctures were common botanical remedies. When synthetic migraine drugs entered the market, plant-based alternatives faded from mainstream medical practice. Yet modern research continues exploring feverfew's preventive properties. It wasn't ineffective. It was overshadowed by stronger, faster pharmaceutical interventions. But its role in history remains clear. Number 13. Milk thistle, the liver protector. Milk thistle has been used for centuries to support liver health, particularly in cases of toxin exposure. Its primary compound, silymarin, has been extensively studied for hepatoprotective properties. Even today, silymarin extracts are used in clinical settings in parts of Europe. But as pharmaceutical liver treatments advanced, whole plant preparations lost primary status in conventional medicine. The irony, modern medicine still studies the plant's compounds for their protective properties. Milk thistle wasn't discarded. It was compartmentalized, shifted from primary to complementary. Number 14. Valerian root, the natural sedative. Before synthetic sleep medications existed, valerian root was used as a calming agent for anxiety and insomnia. Ancient physicians documented its sedative properties. Modern research has explored valerian's potential effects on GABA signaling, a neurotransmitter pathway also targeted by many pharmaceutical sleep aids. When prescription sedatives entered mainstream medicine, valerian was relegated to herbal shelves. But its mechanism of action was not imaginary. It influenced the same biological systems modern drugs now target. Valerian represents a pattern. Plants that influence pathways first, drugs that refined and intensified them later. Number 15. Cinnamon, the blood sugar regulator. Cinnamon has been used for centuries, not only as spice, but as medicine for metabolic support. Traditional systems observed its effects on circulation and glucose balance long before blood sugar meters existed. Modern studies have examined cinnamon's potential influence on insulin sensitivity and glucose metabolism. Yet once pharmaceutical glucose-regulating medications became standardized, cinnamon's role in mainstream medicine narrowed. It wasn't powerful enough to replace insulin, but it wasn't powerless either. It became secondary, supplemental, supportive. And that shift reflects the broader story. Plants once stood at the center. Now they stand at the margins. Number 16. White pine, the vitamin C replacement. Long before synthetic vitamin C tablets were manufactured, pine needle infusions were used to prevent and treat scurvy. During early North American expeditions, indigenous knowledge of pine needle tea saved entire crews suffering from severe vitamin C deficiency. Pine needles contain significant levels of vitamin C, along with bioflavonoids that support absorption. When ascorbic acid was isolated and mass-produced in the 20th century, scurvy prevention became pharmaceutical. The plant source was no longer emphasized, yet the discovery itself did not begin in a laboratory. It began in forests. White pine wasn't primitive medicine. It was the original supply chain. Number 17. Licorice root, the adrenal and respiratory supporter. Licorice root has been used in traditional Chinese medicine, Greek medicine, and Middle Eastern herbal systems for thousands of years. It was valued for soothing respiratory irritation and supporting stress resilience. Modern research has studied glycyrrhizin, a compound in licorice associated with anti-inflammatory and antiviral activity. In fact, derivatives of licorice compounds have been investigated for respiratory viral support in clinical settings. But raw licorice root fell out of favor in mainstream medicine due to dosing concerns and the rise of steroid-based anti-inflammatory drugs. Steroids work faster, they are standardized, they are predictable. But licorice influenced similar inflammatory pathways long before synthetic corticosteroids existed. It wasn't replaced because it lacked action. It was replaced because synthetic options were stronger and patentable. Number 18. Berberine-containing plants. The metabolic blueprint. Plants like barberry and golden seal contain berberine, a compound now heavily researched for metabolic and blood sugar regulation. Modern studies suggest berberine may influence insulin sensitivity and glucose metabolism in ways comparable to certain pharmaceutical agents. Today, berberine is extracted, purified, and sold in isolated form. But the whole plants containing it were once used broadly in herbal systems for digestive and metabolic concerns. The pattern appears again. The compound becomes pharmaceutical. The plant becomes secondary. Berberine didn't appear from nowhere. It came from roots that people used for generations before laboratories identified its structure. Number 19. Poppy, the origin of pain control. Perhaps one of the most striking examples of plant to pharmaceutical evolution is the opium poppy. For thousands of years, poppy extracts were used to manage severe pain. Eventually, scientists isolated morphine from the plant, then synthesized derivatives, then refined those derivatives into modern pain medications. The plant itself was too variable, too potent, too difficult to regulate in raw form, so it became controlled substance territory. But the origin of modern analgesics traces directly back to a flower. The system didn't invent pain relief. It refined what already existed in nature. Number 20. Foxglove revisited. The pattern made clear. We mentioned foxglove earlier as the source of digitalis, but it deserves closing emphasis because it demonstrates the entire pattern clearly. A plant with measurable effect, used carefully for generations, studied by early physicians, then isolated into a pharmaceutical compound. The plant was not dismissed because it failed. It was modified into something standardizable. That pattern repeats across history. Willow to aspirin, foxglove to digitalis, artemisia to artemisinin, plants to pills. Modern medicine did not emerge in opposition to plants. It emerged from them. When you look at these 20 plants together, something becomes undeniable. Modern medicine did not replace plants because plants were useless. It replaced them because plants are variable. Plants are difficult to patent. Plants are harder to dose precisely. Plants grow freely. Pharmaceuticals offered standardization, predictability, mass production. But that does not erase origin. Behind many modern drugs, there is a leaf, a root, a bark, or a resin that came first. And even today, research institutions continue studying plant compounds for new drug development because nature remains a blueprint. These plants are not competitors to modern medicine. They are its foundation. They represent centuries of observation before microscopes existed. They remind us that healing knowledge did not begin in laboratories. It began in fields, forests, mountains, and gardens. And in many cases, the plants that once stood at the center of medicine still grow quietly, where they always have, waiting to be remembered.